Skin in its natural state is always under functional tension. Its viscoelastic properties allow it to react dynamically to movement and pressure. Microscopically, skin is a dynamic system including keratinocytes, fibroblasts, structural components including collagen and elastin, and blood vessels. When skin is cut, functional tension is reduced, and cellular structures inherently take on a stable configuration. The normal healing process of skin leads to rapid proliferation of granulation tissue, which locks the wound edges and prevents further movement. The addition of negative pressure wound therapy enhances the formation of granulated tissue and develops a senescent or chronic wound. Once the wound edges are granulated and fixed, they become very resistant to reapproximation. However, skin can be returned to its original state when dynamic appositional forces are maintained in the early stages of healing. Cellular structures return to their normal tension configuration, and granulation is reduced. This prevents the skin edges from becoming fixed and promotes fast healing. When additional tension is introduced, further biomechanical processes come into play. Mechanical stretch causes the tissues to elongate. Skin cells and collagen fibers straighten and align. Elastin fibers microfragment. Once the skin reaches the limits of mechanical stretch, biological creep takes over. In this natural physiological process, fibroblast numbers increase and become activated, synthesizing new collagen. Vascularity is increased and new skin cells are created. Mechanical stretch and biological creep act together to expand skin to almost limitless proportions. This mechanism of tissue generation occurs naturally every day. Southmedic has developed a series of products that leverage the skin's natural physiological processes. The core of Southmedic's dynamic tissue systems technology is a proprietary, stretchable, silicone elastomer. With anchors on either side, the elastomer spans the open wound. The closure system used is determined by the type and size of the wound. When applied, these devices exert appositional forces, which counter the lateral retracting forces of a wound. The unrelenting traction restores skin's elastic integrity and minimizes granulation, preventing a chronic wound state. A gentle increase in dynamic tension triggers mechanical stretch and biological creep that promotes skin movement and new skin growth through an entirely natural process. In abdominal surgery, the devices exert appositional forces that counter the natural retraction of the anterolateral abdominal muscles and prevent muscle fibers from becoming fixed in a retracted position. Southmedic has employed this core technology in a family of products that address numerous clinical scenarios. DynaClose is a topical skin closure device. The adhesive ends are made with a soft, stretchable fabric tape that is highly breathable and painless to remove. The clear silicone elastomer strip spans the wound without sticking to it and provides the dynamic tension that is the core DTS technology. The device provides an easy, comfortable, and non-invasive method to close retracted or dehisced wounds up to 5 centimeters in width without sutures, staples, grafts, or negative pressure. DynaClose is compatible with wound bed dressings. For larger or higher tension wounds, the ABRA line of products is indicated. All ABRA systems use Southmedic silicone elastomer cords to provide the appropriate amount of therapeutic force. Southmedic's elastomers have calibrated black markings along their surface. These are used to gauge and administer the correct amount of therapeutic force by stretching the elastomer to a maximum of 2 times its original untensioned length. In the ABRA adhesive system, elastomers are secured to their anchor through a wire cleat that makes the tension easy to set and adjust. The elastomer is paired with a complex adhesive anchor that mimics the skin's natural elasticity and distributes shearing forces to prevent blistering. The device applies a dynamic appositional tension that prevents retracting forces, yet yields to shearing forces and improves patient comfort. ABRA adhesive is used for pre-surgical skin expansion as well as for wound support and healing, leaving nothing behind except a sound primary repair. ABRA Surgical is indicated for use with high-tension retracted skin defects. The device applies appositional forces through stainless steel anchors that are fixed to the skin and elastomers that are placed subcutaneously. With tension, the wound margins are everted to inhibit granulation and to maintain healthy, viable margins. A wire cleat secures the elastomer and enables easy tension adjustments. Stainless steel flukes and a rear staple engage the skin's full thickness to distribute closure forces evenly. ABRA Surgical restores normal skin integrity, normalizes compartment pressures, and achieves a primary closure, eliminating the need for a skin graft. ABRA Abdominal is specifically designed for abdominal wall wounds. The system applies appositional forces on the retracted abdominal wall by placing each layer of the abdominal wall under therapeutic force. The button anchor secures the elastomer and allows easy tension adjustments. The button pad and adhesive button tail distribute closure forces over a large area of healthy skin. The button pad's position ensures that the elastomer doesn't pull on the skin. Medial traction is applied lateral to the fascial wound edge, leaving the margin undisturbed and available for primary suture closure once the wound has been approximated. A perforated silicone sheet protects the viscera while preventing adhesions from forming. ABRA Abdominal is indicated for retracted, full-thickness midline abdominal closure. DynaStretch is an atraumatic preoperative skin expansion device. The soft, stretchable adhesive fabric and the dynamic silicone elastomer both have an inherent elasticity, which allows patient mobility as the device works. The product is applied topically 1 to 2 weeks pre-op and is simple to manage and painless to remove. For surgical removal of a skin defect or flap, DynaStretch is indicated when the resulting wound is too large for primary closure under tolerable tension. SutureSafe uses the same elastomer technology as DynaClose with a clear, non-stretch limiter to support closed incision lines and prevent dehiscence of the wound. During application, the strip is stretched until the ripstop is flat. Then the device is applied across the closed wound. This product provides a simple means of supporting a closed incision line to reduce pain, prevent dehiscence, and mitigate scar formation. In cases such as compartment syndrome, immediate wound closure may not be indicated. Southmedic's dynamic tissue systems are placed early after surgery to prevent further retraction and keep the wound edges mobile until such time as a delayed primary closure is possible. The devices exert a moderate dynamic tension continuously on the wound. Left alone, wound edges become granulated and fixed in an untensioned, retracted position. This state is increasingly difficult to reverse. Application of moderate appositional forces recreates the tension of intact skin in its natural state. The system is gentle enough to adapt to patient movements, maximizing comfort and reducing recovery time. The wound edge remains mobile and granulation is minimized. Unrelenting moderate tension is essential for retraction prevention after a fasciotomy. With early application and diligent adjustment of the devices, additional surgeries are avoided and delayed primary closure can be achieved sooner. Removal of skin defects traditionally results in a void of skin, often addressed by skin grafting with mixed results. Southmedic's DynaStretch offers the ability to easily and painlessly create a pre-surgical skin depot in order to close the void and perform a tension-free primary closure. The devices apply a gentle but unrelenting tension to the skin. This approach takes advantage of the inherent extensibility of skin to induce mechanical stretch and biological creep. With the right amount of applied tension, skin can be expanded almost indefinitely to produce as much new tissue as required. Healthy skin is grown at the margins, and a skin depot accumulates around the defect. The process is non-invasive and simple to apply and adjust. Creation of the depot can take as little as a week. The dynamic tension allows patient mobility as the device works. The skin depot allows for immediate, tension-free primary closure, eliminating multi-staged surgical procedures. Cosmetic results are significantly improved. Indications for pre-surgical skin expansion include melanoma excision, skin graft revision, birthmark or tattoo excision, and burn patient donor site expansion. Closed wounds under high tension are susceptible to pain, inflammation, dehiscence, and hypertrophic scarring. Suture-safe strips are applied over the closed wound, providing dynamic low compression forces that counter the tendency to dehisce. The constant low appositional forces create a safe zone lateral to the skin edges that adapt to the patient's movements. If excess lateral tension is exerted, SutureSafe's ripstop feature prevents further pulling on the incision. Reduced pain encourages patients to be more mobile, thereby improving recovery times. The incision remains under very low or no tension during the healing process, dramatically reducing scar formation. Whether a wound is closed by staples, sutures, or glue, reinforcement by SutureSafe improves patient comfort, recovery time, and cosmetic results. When skin is cut, its natural surface tension is lost. This causes the cellular structures to retract to a stable, untensioned configuration. Rapid proliferation of granulation tissue locks the wound edges and prevents further movement, making reapproximation increasingly challenging. Southmedic's dynamic tissue systems apply a dynamic appositional tension that counters these retraction forces. Early application of this system restores the skin's normal elastic tension and minimizes granulation, preventing a chronic wound state. This method harnesses the inherent extensibility of skin. Mechanical stretch realigns and moves tissue. It also induces biological creep, stimulating new tissue growth to quickly and naturally close the wound. The elastomer adjusts to patient movements, promoting mobility and reducing healing time. With early application and diligent adjustment of the devices, skin edges can be quickly reapproximated, reducing the length of hospital stay and avoiding further surgeries by eliminating the need for a skin graft or flap. Southmedic provides a range of DTS products that are essential for the quick and natural closure of almost any wound.